ഹലോ. ആ, പറയാം. ആ, ഞാനിപ്പോ ഇവിടെ ഒരു പെട്ടെന്ന് വന്നു. ഇല്ല. എത്ര മണിക്ക് വരും? എത്ര സമയം കൊണ്ട് വരും? എവ്- എവ്- ഞാൻ അങ്ങോട്ടേക്ക്, ഞാൻ ഹോസ്പിറ്റലിൽ ഉള്ളത്, ഇങ്ങോട്ട് വരുന്നുണ്ടോ എന്ന് ചോദിക്കുമായിരുന്നു.
Hello, Gayatri and Shaira and Gayatri, can you hear me?
Yes, madam, I can hear you.
ഞാൻ രഞ്ജു സാർ ആരെങ്കിലും ഹരീഷ് ആരെങ്കിലും വരാൻ വേണ്ടിട്ട് കാത്തിരിക്കുകയാണ്.
അല്ല മാഡം, ചെറിയൊരു പ്രശ്നമുണ്ട്. ഐ തിങ്ക് മീറ്റിംഗ് കപ്പാസിറ്റി ആയെന്ന് തോന്നുന്നു. വെച്ചാൽ 1-2 പേര് ജോയിൻ ചെയ്യാൻ നോക്കിയിട്ട് പറ്റുന്നില്ല എന്ന് പറയുന്നുണ്ട്.
അല്ല, അവർക്ക് മറ്റേ യൂട്യൂബ് ലൈവിലേക്ക് കയറാലോ.
യൂട്യൂബ് ലൈവിലോട്ടോ?
ഉണ്ടെന്ന് പറഞ്ഞു. യൂട്യൂബ് ലൈവില് കയറാം.
അതിന്റെ ലിങ്ക് ഉണ്ടോ മാഡം? അതിന്റെ ലിങ്ക് ഒന്ന് ഇടാം.
എനിക്കറിയില്ല ഇതിന്റെ എങ്ങനെയാണെന്ന്. ഇത് ഈ വിൻഡോയിൽ ഇത് കാണുന്നില്ലേ, സ്ട്രീം ഓൺ കോപ്പി സ്ട്രീമിംഗ് ലിങ്ക് എന്ന് പറഞ്ഞിട്ടുണ്ട്. ഫ്ലിപ്ബോർഡ് ഞാൻ എന്നാ മെസ്സേജിൽ ഇടാം. ഞാന്
അപ്പൊ അത് ഷെയർ ചെയ്യാം അവരുമായിട്ട്. തോന്നുന്നു അവര് ജോയിൻ ചെയ്യാൻ നോക്കിട്ട് പറ്റുന്നില്ല എന്ന് പറയുന്നുണ്ടായിരുന്നു.
ഇതായിരിക്കും. നോക്ക്, എന്താ ഞാൻ മെസ്സേജിൽ ഇട്ടിട്ടുണ്ട്, നോക്കിക്കേ. ബാക്കിയുള്ളവർക്ക് അത് ബാക്കി കുട്ടികൾക്ക് അത് കിട്ടുമെന്ന് നോക്കും. കിട്ടുന്നു. കേറാൻ പറ്റുന്നില്ലേ? അല്ല, യൂട്യൂബ് ലിങ്ക് ഉണ്ട്. അതിന്റെ ലിങ്ക് അയക്കാം. അതില് അത് ഞാൻ എങ്ങനെ ഇപ്പോ ഇത് ഞാൻ വാട്സപ്പിൽ ഇടാൻ നോക്കാം. ഞാനത് നോക്കട്ടെ അതിലെങ്ങനെ ചെയ്യാൻ പറ്റുമെന്ന്.
മാഡം, ഞാൻ മറ്റേ യൂട്യൂബ് ലിങ്ക് ഞാൻ ഗ്രൂപ്പിൽ ഷെയർ ചെയ്തിട്ടുണ്ട്. അപ്പം ഞാൻ നോക്കട്ടെ അത് വഴി കയറാൻ പറ്റുന്നുണ്ടോ.
എനിക്ക് സെൻഡ് ചെയ്യാൻ എനിക്ക് അറിയാം. എല്ലാ യൂസർക്കും വെച്ചേക്കെ അത് കുഴപ്പമില്ല.
അങ്ങനെയാണെങ്കിൽ സ്റ്റാർട്ട് ചെയ്യണോ? എങ്ങനെ? അത് ഹരീഷിന്റെ അടുത്ത് ചോദിക്കണോ? നോക്കട്ടെ, സ്ക്രീൻ ഷെയർ ചെയ്യുന്നത്. Can you see this? 8com കാണാൻ പറ്റുന്നുണ്ടോ? 8com കാണാൻ പറ്റുന്നില്ല?
യെസ് മാം കാണാം.
അല്ല, ഹരീഷിനോട് ചോദിക്കാൻ കാണുന്നുണ്ടോ? ഏറ്റവും യൂട്യൂബ് ലിങ്കിൽ കാണുന്നുണ്ടോ? നോക്കട്ടെ, ഞാൻ നോക്കട്ടെ.
മാഡം യൂട്യൂബ് ലിങ്ക് ഓപ്പൺ ചെയ്യാൻ പറ്റുന്നുണ്ടോ കേട്ടോ മാഡം?
പറ്റുന്നുണ്ടോ? ഇത് തന്നെ കാണുന്നുണ്ടോ? ഏറ്റവും കാണുന്നുണ്ടോ? ഇത് ഈ ഷെയർ ഇത് കാണുന്നുണ്ടോ? ഏറ്റവും തന്നെ സ്ലൈഡ് കാണുന്നുണ്ടോ? യെസ് ഓർ നോ?
യെസ് മാം.
കാണുന്നുണ്ട് അല്ലേ? സോ ഐ തിങ്ക് വി കൻ സ്റ്റാർട്ട്. സോ good evening everybody. So at the outset, let me introduce myself. So I hope I'm audible. Am I audible? Am I audible?
Yes ma'am.
Okay. So when I'm showing certain videos, do let me know whether the video is audible or not. So you may have to use your headphones. So the very concept of communication also will be affected, if you can't see the videos. So I'll do one thing, I'll tell the introduction and other things and if you're not able to see the videos, I'll send you the YouTube links of those videos. So you can share it in your group. Okay. So let me introduce myself. I'm Dr. Shaira. I'm Associate Professor ENT. So I'll be chairing today's session. Okay, this is, as you know, it is about communication skills. So this is part of phase 2 of 8COM. Okay, and this phase 2 8COM group is headed by Dr. Ranju Ravindran sir of Forensic Medicine. Then Dr. Srilata madam, our senior faculty from pediatrics, is also there. Then Dr. Shibu sir from psychiatry, Dr. Manju from anatomy, Dr. Sneha from physiology, then Harish sir from forensic medicine, and Gayatri is also in your group now. She's my student, now my colleague from SPM. And I think there are many more. I think Sarita, Anu Mary, Anupama, and all are there. So we have also other members from other various departments. So in phase 2, you have 8 modules during your phase 2. Okay. So first module of communication, I'll be dealing it. My senior colleagues and other fellow members will be dealing with the other 7 modules. Okay. So even in this communication skills are there in all the phases. Phase 1, phase 2, phase 3, phase 4. Just one sec. So you have this communication skill in all the phases. So phase 1 also, 2, 3, and also phase 4 also will be having it. So you need communication skill throughout your career. No? So, so today's topic is part 2. Okay, but then we'll be dealing with the same thing, and as you go on, you can improve your skills. Okay, so today's, what is the SLO? You should be able to demonstrate the ability to communicate to patients in a patient, respectful, non-threatening, non-judgmental, and empathetic manner. So this is the SLOs. Okay, and now you'll be thinking, why do you need to learn this communication skills? You know, you feel like everybody knows how to communicate and all. Is it necessary to learn? So I know many of you have got good communication skills. So they have a natural instinct, they have natural skill, but many of us are not born with that. Okay, we have to learn little bit. But even then, you all will be thinking, like, why do we need to learn, study? Like, it is not a theoretical topic. Like, we have been communicating ever since we are born, right from the first day. Don't you think an infant also can communicate, no? By like, how does it communicate to its mother that it's hungry? By crying. Like, the infant, when infant is happy when you see it smile. So that is all a method of communication. Okay. So why do we need to learn? Okay. So let us see, like, it is somewhat similar to learning to cycle. So all of you, I think most of you know how to cycle a lot. But for those person who don't know cycling, if I tell you, like, this is how you learn to cycle, you feel it is very absurd. So now if I tell you, keep your left foot firmly on the ground, swing your right leg across the bar, and then you be seated comfortably, press the right pedal to the top, apply firm pressure on the right pedal so that it reaches the bottommost position. So this will bring the left pedal simultaneously to the top. Now push the left pedal. And this is how you can learn cycling. So you feel like it is very silly. Okay, do you need to learn to cycle? Okay. But this is, if everything goes on right, like, you don't think like you need to learn anything extra to cycle and all. But just imagine, like, if a cyclist, the country's topmost cyclist, has to bag an Olympic medal and all. So the coach will be trying to tell the cyclist, just one. So if the cyclist is to be coached by a trainer, then how does the coach tell the cyclist? He tells him various tricks to increase the speed. He'll be telling, like, you press over here, this will increase the torque with minimal effort. This will, by bending forwards, you can decrease the airway resistance and improve the aerodynamics. So thus he'll be coaching that cyclist to ride faster, more efficient, and more, and he can be a winner. So also, like, what we have done is, like, for communication skill also, like, experts have broken that communication skill into various steps. And if something goes wrong in communication, like, you can dissect it and find out where your communication has gone wrong, whether it is in the building a doctor-patient relationship, or whether it is in your opening remark, or whether it is during gathering the information and all. Okay, whatever be that communication, this is several modes. Okay, so all of you will be thinking communication means it is only verbal, but experts, what they say is non-verbal part forms the maximum, conveys the maximum meaning. So they say 55% of the meaning is in the facial expression. 38% of the meaning is paralinguistic, that is the way in which the words are said. And only 7% of the meaning is in the words that are spoken. Now, suppose, like, you find the doctor when you, when a patient comes into your, when the patient enters the doctor's consultation room and the doctor is fiddling with the mobile. He's twirling his pen, and then he's not looking into the patient's eye. The doctor is in a hurry. So even though the doctor hasn't spoken anything, still what is the message that is being sent to the patient? That the doctor is not interested in listening to the patient. The doctor is in a hurry. Okay, so this is all a part of non-verbal communication. So you have to be you have to pay attention to non-verbal communication also. So how we are seated also, like, if you are seated leaning too forwards also, like, it can be termed as being too aggressive. In ENT examination also, sitting is very important. Like the patient's, the doctor should not be seated with the patient's legs between your legs. So all that will give a very different meaning to the patient-doctor relationship. So in order to convey this doctor-patient relationship, like experts met in May 1999 at Kalamazoo. That was a place in Canada. And 21 leaders and representatives from various countries, along with the Bayer Institute of Healthcare and Communication, they formulated about 7 steps that are very important for communications. So this is what is called as Kalamazoo Consensus for Communication Skills. So these are the 7 steps. Builds the doctor-patient relationship, open the discussion, gather information, understand the patient's perspective, share the information, reach agreement on problems and plans, provide closure. So all this will seem like you might not understand now, but you would have gone through all these steps, like when you meet a doctor or when you have been to clinics and all. So each step blends into the other. There's no clear-cut demarcations. But if something is to go wrong, like we can tell, like this is a point at which the doctor lagged. Doctor might be very efficient in gathering the information. Like he or she will be very knowledgeable about the patient's clinical complaints, but she may be lacking empathy. Okay, so let us see like what are the various steps. So now is the first step is building a doctor-patient relationship. So what is this building a doctor-patient relationship? So when does a doctor, where does a doctor and patient meet? So either it can be in the doctor's consultation room or in a ward, or it can be in a patient's, a room. Patient might be admitted in a hospital, and the patient in the inpatient room, there can be a meeting between the doctor and the patient. So suppose the doctor is in the consultation room, and when the patient walks in. So how does a patient-doctor relation? What do you mean by building the patient-doctor relationship? So doctor has to confirm that the patient he is seeing and the details that he is entering is the same person's record of case sheet. That is, when the patient enters, you can tell, hello, so that is what is meant by building the doctor-patient relationship. You can't just put your stuff onto the patient without asking the patient's name, age and all. You have to confirm whether it is the same patient that you're writing the details or the records of. And also when you're going into the ward, what should you do? The doctor has to knock at the door, then introduce oneself. We have to tell, like, doctor, hello, I'm Dr. Shaira. And then you have to confirm, like by looking into the case sheet and by asking the patient's name and age. So this is what is meant by a doctor-patient relationship. Let me show you like how this happens in a real setting. This is a video taken from YouTube.
Come in.
Is the audio, is it audible? Is it audible, anybody? Amrita?
Yes, ma'am. It's audible.
Is it audible?
Yes, ma'am.
Okay.
I'm just back again. Yes. Yeah, it's not that long since you were last here. I know, but I'm really not happy with these heavy periods I've been You're not happy? Well,
so here, I don't think so. She asked the patient's name and the age and all. Like this is what we mean by building the patient-doctor relationship. and the beginning itself is not proper. So this is a wrong example, and she's being very rude, and her eye contact is also not there, and she's more looking towards the computer.
No, I've been to see you several times, and you've put me on tablets, and you know they're just not working. And
But you've
I'm
not-
really thinking I want to.
Excuse me. You've not had the time to take the whole course of.
And another thing that you notice that after that, like the doctor is interrupting the patient, not giving her enough opportunity to listen to the patient. So the doctor, the initial step itself is wrong. Okay. Now let us look into this video also.
Hello. Sorry to keep you waiting. Busy day.
Jack McKee.
Yes, I know. Have a seat.
Right.
So the patient offers offers the doctor the hand, but she refuses to accept it. Maybe she's busy washing her hands at least, but she could have told like, I'm washing. So like after washing the hands, at least she could have shook hands with the patient.
Murray Kaplan sends his best.
Oh, that's right. You're in practice together.
Will we get it right?
So what seems to be the trouble?
What?
So next is the next step I told you is open the discussion. Now this is what the doctor has done now. She asked him like what seems to be the problem now. So that is what we mean by opening the discussion. So while opening the discussion, you have to ask an open question, that is open-ended question. You can't ask, do you have fever? Means where the answer is just yes or no. That is what I mean by closed-ended question. So to begin with, asking a closed-ended question would be wrong. To begin a conversation, നിങ്ങൾക്ക് എന്താണ് ബുദ്ധിമുട്ട് അല്ലെങ്കിൽ എന്താണ് പ്രശ്നം? What brings you here? What is troubling you? So that the patient gets full freedom to answer, think and answer. Rather than asking നിങ്ങൾക്ക് പനിയുണ്ടോ, നിങ്ങൾക്ക് ചുമയുണ്ടോ, നിങ്ങൾക്ക് തലവേദനയുണ്ടോ. You can ask all this, but not at the beginning. So to begin with, like you have to ask an open-ended question.
Nothing. I mean, I have a tickle. I've been hoarse.
Take a look. Cross your knees. Sit back in the chair. Sit up. Hands on your knees. Chin forward. And open. Let's take a look. Close. Open. Open. Right. Open. Might be a little bitter.
It's an anesthetic.
Want to take a closer look?
Whoa, a periscope.
Won't be pleasant. Tongue out. Pull it. And hold it. With your hand. Head forward. And open. And E. Again. 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 One more time. That's all I need. Doctor, you have a growth.
What?
Tumor, laryngeal. Here on the true vocal cord?
I know what laryngeal is.
We're gonna do chest x-rays, blood chemistry, blood count, UA, EKG. Have to check with my secretary, but if it's remotely possible, I'd like to do a biopsy tomorrow. Okay?
Thanks.
Don't mention it.
So here the doctor is very efficient in examining the patient, very efficient in diagnosing, but what she lacks is that empathy. She lacks empathy in dealing with the patient. Like there was no empathy, like the conversations were not very warm. It was like there's something, what do you tell? That warmth is absent. So that is which is lacking over there. So I told you what is important for gathering an information. Gathering information, listening to the patient is very important. So what they say is, we have been given 2 years, but only 1 mouth, because listening is twice as important and hard as talking. So while gathering information, like you have to listen to what patient tells. You should not interrupt the patient. Then how do you know, like whether the doctor is listening to the patient or not? So this, you have to give little time after asking questions. So you have to give a pause after asking questions, and also you can make certain what do you tell? After asking questions, you can add little encouraging words, like add sounds like is that so? Anganeyano, ennittu. So all those words, if you add, when the patient is narrating the history, you can know that the doctor is listening carefully. Okay. For example, ഭയങ്കര വേദനയായിരുന്നു. Then when the doctor tells, oh, is that so? ശരി. എന്നിട്ട് എന്തായി? When the doctor tells all those words, like patient also feels the doctor is actively listening. And another way how you can tell the doctor is listening would be repeating back the patient's words. So for example, like when a patient tells, like എനിക്ക് paracetamol injection തന്നപ്പോൾ allergy ഉണ്ടായി, then the doctor also repeats back the words. Oh, ശരി, paracetamol മരുന്ന് കൊടുത്തപ്പോൾ injection ഉണ്ടായി അല്ലേ? എന്നിട്ട് എന്ത് സംഭവിച്ചു? Admit ആയിരുന്നോ? So that is what is meant by mirroring or repeating the words. By repeating the words, you are verbalizing the empathy. So that is all important in while gathering the information. So here, while gathering the information, the content is also important. Like I showed the earlier ENT doctor, like she could diagnose the laryngeal cancer, but all the content is very good. But the process of doing it, like it was lacking in empathy. Okay. Now, next would be understanding the patient's perspective. So patient will be telling multiple complaints, but they'll be hesitant to answer certain things. They'll be hesitant to divulge their fears. So in those cases, like you can ask them. For example, many a times in the ENT department, like we had patients coming with telling multiple complaints in the throat, and we never find any problems. So when they come repeatedly, I usually ask them, like what is it that you're fearing? What is your opinion about what is causing your problem? Is it the fear of cancer? Then they confess, yeah, it is cancer. And then I ask them, like, did anybody in your family or in your neighborhood die of cancer? Usually it will be so. So once they feel all those, they always have that fear of cancer. So what I usually do is, like, I tell them, like, it is not due to cancer and all. you're too young, you don't have any history of smoking alcohol, and you're a lady, like the risk of cancer is very less. We have examined the throat completely, and at present you don't have any problem. Like we have given drugs to alleviate your problem, and if you need to, if you have any more problem, we can do further endoscopies. You can come for follow-up. So we have to ask questions to the patient. You have to understand the patient's perspective also. And many a case, sometimes you feel like the patient is not interested in the following the treatment. The patient is not following the doctor's instructions. So it may be because the patient has not taken the drugs because he cannot afford it. He might have lost his job. He might be having financial problems. So you have to understand the patient's from the patient's perspective also. So that is what we mean by. So you can ask certain questions, some socio-economic conditions, other cultural concerns, beliefs, etc. So that is what we mean by this. Now, next would be the sharing the information. So once you have elicited all the history and all, like you can you have to paraphrase or summarize all whatever the patient has told in your own words. So suppose the patient has come with history of hoarseness and all. So I have to tell the patient, I'll be repeating back the patient's history. അപ്പോൾ നിങ്ങൾക്ക് 3 മാസമായിട്ട് തുടർച്ചയായിട്ട് തൊണ്ടവേദനയുണ്ട്, തൊണ്ടയിൽ പിന്നെ കഫക്കെട്ടുണ്ട്, ശബ്ദത്തിന് വ്യത്യാസമുണ്ട്, പിന്നെ നിങ്ങൾ സിഗരറ്റ് വലിക്കുന്ന ആളാണ്, മദ്യപാനം ഇടയ്ക്കൊക്കെ ഉണ്ട്. ഇതൊക്കെയല്ലേ നിങ്ങൾ നിങ്ങളെ പ്രശ്നങ്ങൾ, ഇതൊക്കെ ആണോ ബുദ്ധിമുട്ട് എന്ന്. So you have to ask them. So that by telling like this, what does the patient feel? The patient will know that the doctor has completely understood his or her problem. So when the patient, then the doctor will ask, "Idakka parnay sheriyalle?" Then the patient has to tell, "Yes, idakka thaneyanu ende prashnam." So that is what you mean by sharing the information or paraphrasing, summarizing in your own words. And while telling the diagnosis also, you tell the convey everything in the patient, in words like which the patient can understand. So don't tell that the patient, you have got congestive cardiac failure. The patient would not understand all those medical terms. You can tell ningala heart inde pumping ine korchoru prashnam undu. So this is what we mean by sharing the information. And you can also ask the patient's like what the patient thinks about what has caused this problem. Well, then the next stage would be reach agreement on problems and plans. Okay, so whenever you're deciding something, encourage the patient to participate in the decisions also. Okay. So what I mean by this is the doctor tells that like the problem of hoarseness is due to like if a patient with hoarseness has come to me, so I'll be telling him like നിങ്ങളെ ശബ്ദത്തിന് വ്യത്യാസം വന്നിരിക്കുന്നത് നിങ്ങളെ തൊണ്ടയിലുള്ള വോയിസ് ബോക്സിൽ ഒരു വളർച്ച ഉള്ളത് കാരണമാണ്. അപ്പോൾ അത് കുറെ കാരണങ്ങൾ കൊണ്ടായിരിക്കാം, TB കാരണമായിരിക്കാം, അല്ലെങ്കിൽ കുറെ ഒച്ച ഇട്ടതിന്റെ ആയിരിക്കും, അസിഡിറ്റി കാരണമൊക്കെ ആയിരിക്കാം. ഏതായാലും നമുക്ക് കുറച്ച് ഇൻവെസ്റ്റിഗേഷൻസ് ഒക്കെ ചെയ്യണം, രക്തപരിശോധന ചെയ്യണം, ചെസ്റ്റ് എക്സ്റേ എടുക്കണം, കഫൺ ടെസ്റ്റ് ചെയ്യണം. ഇതിനൊക്കെ കുറച്ച് സമയമൊക്കെ എടുക്കും. സോ ദിസ് ഇസ് വി ആർ ടെല്ലിംഗ് അബൌട്ട് ദ പ്ലാൻ. അപ്പോൾ ഇതൊക്കെ കുറച്ച് സമയം എടുക്കും. അപ്പൊ തൽക്കാലം നിങ്ങൾ ഈ മരുന്ന് എടുക്കുക, എന്നിട്ട് അടുത്ത തിങ്കളാഴ്ച വരിക. പിന്നെ ഓൾസോ you have to tell the patient not to worry also. എന്തെങ്കിലും പ്രശ്നം ഉണ്ടെങ്കിലൊക്കെ നമുക്ക് അതിനൊക്കെ ചികിത്സയൊക്കെ ഉണ്ട്. അപ്പൊ എന്തെങ്കിലും ഇപ്പൊ നമ്മൾ പ്രശ്നങ്ങളൊക്കെ നേരത്തെ തന്നെ കണ്ടുപിടിച്ചുകൊണ്ട് like you will be at a greater advantage. So this is how you tell about the problems and plans. Then last stage would be providing closure. So you ask whether the patient has got any other problems or not. So sometimes the patient tells like, അയ്യോ അടുത്ത തിങ്കളാഴ്ച ആണെങ്കിൽ എനിക്ക് പ്രശ്നമാണ്, എനിക്ക് കാർഡിയോളജിയിൽ ഒരു അപ്പോയിന്റ്മെന്റ് ഉണ്ട്, അപ്പൊ എനിക്ക് അന്ന് വരാൻ പറ്റില്ല, അന്ന് ENT ഉണ്ടാവുമോ, അങ്ങനെയൊക്കെ ചോദിക്കാം. സോ ലൈക്ക് വി ക്യാൻ മേക്ക് എ പ്ലാൻ. ഓക്കെ, രണ്ടും ഉള്ള ദിവസം ഒരു ചൊവ്വാഴ്ചയായിരിക്കും. അപ്പോൾ വന്ന് കണ്ടു. So that is how you make further plans. Okay, and then you agree to come to a final agreement, and you document all this. You write all the history, all the findings. You document all this in a OP ticket or case sheet. So this is what is called as a SOAP notes. SOAP. SOAP means S is for subjective, O for objective or the clinical findings. A is like whatever assessment you have done, and P is a plan that you have done. What is the plan? As I told you earlier. So whatever you have done, you can write it in your notes. So all this will seem little difficult, like this is because it has been split into various parts. Now, how can we learn this? So learning part, I think next week or next Saturday or coming 30th, I don't know, it will be holiday, or next, I think the first Saturday of November, I think we'll be doing various role plays. So I'll give you certain case scenarios. You can enact them. So one of you can be, about 10 to 15 case scenarios will be given to you. You can divide yourself into 10 or 15 groups. Now each group there will be a leader, a faculty to train you also. And you can do a role play. One of you can be a doctor, the other can be a patient. And all those case scenario can be recreated. And now we will, and your your mentors will be guiding you. And after that, we'll be telling like what all went on good and where there was little defect and how you can improve it. So here, like, don't worry, like we are not looking into the histrionics or what is it, ability to act and all. Like we want to see only the communication skills. Okay. So if we as faculty will be there to help you. So repeatedly, if you do this role play, you can video record like consultations and all, and then show it to somebody. Then you can know what has gone wrong. Then you can learn from your mistakes. Even let me tell you, like we have also been been taught all this communication skills. Like when we came into MBBS, like we were never taught. We learned from our surroundings and all. And we learned it the hard way. We made many mistakes. We learned from our mistakes. And then still, even now, we are learning from our mistakes. We do make mistakes even now. But from each episode, what we do is we reflect upon what went wrong. And we learn from our mistakes. So by this 8-com sessions, I think like you can, fast forward all these things, and you can learn this communication skills at a faster rate and more efficient way. And how do we have also various checklists to know like whether you have taken all these steps. In OSCE also, like we have a checklist of like whether you have greeted the patient properly, whether you have introduced yourself and all. So similarly, you have various checklists. So few of the checklist is Brown interview checklist. I'll be giving you a link of that. Then Calgary Cambridge Observation Guide, that is called the CCOG guide. Then SEGU guide also is there. And what we are following it is the Kalamazoo checklist. So now also look into two, communication techniques. So the first encounter is a bad encounter, and the second encounter is a good, the communication skills have been improved. Just watch this and you can know what makes a difference.
Communication techniques. Evaluate these. Consider the patient's response.
Are you a nurse? Mrs. Miller, I am a nurse. Can you get me some pain medication? That other nurse last night was just awful. I only saw her once at the beginning of the shift, and I'm really, really uncomfortable. And I just don't feel good at all. Is there any way you can give me some relief?
Well, first off, I need to do a complete assessment on you before I do
How long will that take?
20 minutes. Because I'm very busy. And we have
But,
other
but
patients. other
I'm
than you.
very uncomfortable. Is there any way, she didn't do anything for me last night.
All right, well, on a scale of 1 to 10, 10 being the worst pain you ever had, 1 being no pain, or 0 being no pain, where's your pain level?
8 or 9, maybe going more. It's just, I haven't had anything to give me any relief. I haven't had any sleep last night. I kept buzzing the buzzer and she just wouldn't come in. Well, can you do anything for me?
Let me go check your medication first.
Can you please hurry?
Well, you're not the only patient I have today, so I will do it as fast as I can do it.
I hope so.
All right, I'll be back.
If not, I'm gonna talk to your supervisor.
Okay, well, I don't think that's really necessary.
It may be, I hope not.
Okay, well, I will go check right now for your pain meds. I'll be back.
Thank you. Come in.
Hi. Mrs. Miller, you were resting. I didn't know if I wanted to disturb.
I almost went to sleep there for a minute. I couldn't believe it because I didn't sleep very well last night at all. I was up most of the night. And so after you gave me the pain medicine, I felt a little bit better and I almost nodded off.
Oh, well, if you need to nod off, go ahead and we will
Well, I probably won't because they're gonna do it for some kind of procedure.
They are, this afternoon. You're gonna have that biopsy done, so they'll come and get you and take you down.
Yeah, I hope that'll be okay.
Okay, are you clear on everything?
Well,
For the procedure?
will it hurt?
Well, they'll put you to sleep. We had talked before, you took your little nap, they will put you to sleep with anesthesia, and it should not hurt during the procedure. After the procedure, there could be some pain, but when you get back to the floor, and also right after you get out of surgery, the nurses in the receiving room will make sure that you're medicated, and we'll get you back to the floor, and I'll make sure that you have your pain meds.
When will we know the results?
They take a couple days, and so your doctor will receive them, and then he will be sharing those with you.
Okay, I'm just kind of worried. I mean, I just don't know what's going to happen.
Yeah, I'm sure it's not a easy thing right now. The unknown is always a bit scary, isn't it?
So from this, like you can see that the second episode, now there is a cordial relationship between the health professional and also the patient. So this is another way, where a doctor, this is a standardized patient. That is the patient is not a real patient. This is what happens in UK and all. Like they have a standardized patient, and the patient they are asked to take a history and all, and the doctor himself assesses how the doctor has taken the history and the various communication skills. So if you watch it, you'll
Miss
understand.
Bellamy, or can I call you Pat?
Pat's fine.
Great. Well, it's nice to meet you.
Nice to meet you.
Can you tell me why you're here today?
I have a terrible headache.
Looks really bad. Is there anything else besides your headache that you want to address here today at the clinic appointment?
No, it's just that, except I am concerned. I just recently changed insurance companies, and I'm not sure this is going to be covered yet.
All right. Was there anything, because what we can do is while we're talking and I'm doing your history and physical, I will have my office secretary look into the insurance plan that you have.
All right.
So you don't have to worry about that.
That sounds good.
Okay, sounds great. Is there anything else?
No, this is just really bad.
Okay. So what I'd like to do today is let's take a look at what's causing your headache. Right. I will go over history, physical, and then we'll do again a physical exam, and then we will look into your insurance policy and make sure that's all taken care of. Does that sound like a good plan for you?
That's good.
Perfect. So tell me a little bit more about the head pain that you're having.
Well, it started about 3 days ago, and nothing has helped. It's just laid me flat. I haven't been able to go to work. Nothing's helped. It's all over. It's really bad when I move, so I'm trying not to move too much, and the light is bothering me a lot.
Okay. And unfortunately, I can't dim the lights in this room,
All right.
but so
It's okay.
I'll try to go quickly. And would it be okay if I took some notes?
Oh, sure, yeah.
All right. So you said this headache started about 3 days ago.
Yeah.
Okay. Was there anything that brought it on? Anything unusual that happened maybe 3 days ago?
Not really, no.
Okay. Can you tell me anything that makes it better? Is there
Oh,
anything?
nothing's made it better.
Okay.
I took some Tylenol, I tried
Okay.
Motrin, nothing. I just try not to move too much.
All right. Is there anything that makes it worse?
Yeah,
Like
movement,
movement?
and light.
Okay.
And it's just constant though. There's, it doesn't, it's just constant. It's all over.
Okay. So if you had to rate it on a pain scale, 0 being no pain, 10 being the worst pain you ever
Oh,
had.
it's a 10.
A 10?
I've never had a headache like this.
Okay. Yeah, that sounds really bad. Now, as far as radiation, does it move? You said the pain is all up here in the front of your head.
It's kind of all over.
Okay.
But it also, I've got this shooting pain down my neck, and my neck is very stiff.
Okay.
But it's not. It's the entire head.
Entire head. Okay.
Yeah.
As far as in the timing, you said that started 3 days ago, but
Yeah.
is it constant?
Yeah,
or it comes and goes?
it started gradually, but once it got there, it hasn't gone away. It doesn't get better. It doesn't get worse. It's just the same.
Okay. So do you? What I want to get is your perception of what you think is going on.
Oh, I don't know. I can hardly think. It's so painful. I just because it's so bad, I was afraid. My neighbor had a headache and ignored it last year, and he suddenly started having seizures, and it turns out he had a brain tumor. So I thought I just should come in and.
I can understand your concern. How is it impacting your daily life?
I can't go to work.
Okay.
I can't do anything. Yeah.
Okay. So it sounds like it's really impacting your life.
Yeah, I can't.
Okay. If it's okay, I would like to talk about a little bit about your medical history and your social history. All right. Can you tell me, as far as your medical history, do you have any medical conditions I should be aware of?
I was diagnosed with high blood pressure about 3 years ago, but we've been addressing it with diet changes, and
so it's controlled
been
with
monitored.
diet?
Yeah, I go in yearly. I had been and it's been well controlled. So
okay,
I
great.
haven't been on medication.
No meds for
but
that?
other than that, I haven't had any problems.
Okay. Any surgical history?
No.
Any hospitalizations?
No.
All right. And you said the only medicine you're taking was Tylenol, Motrin. But it doesn't help.
And they didn't help. Yeah.
Okay. Just wanted to verify. Do you have any drug allergies?
No.
Okay. What about family history? Do you have any medical history of headaches or?
In my family?
Right.
My
sisters,
mom
brothers?
said she used to get migraines when she was in her 20s and 30s.
Okay.
But I don't remember her saying anything else about it. My sister, I have one sister, she's healthy. My dad, he has high blood pressure. Other than that, he's healthy, and that's about it. I don't have any kids.
All right. It's all right. I would like to ask you some social history questions that, just for our records.
Okay.
Do you smoke?
Yeah, I do.
Okay. Is it cigarettes or chewing?
Yeah, cigarettes.
Okay. And how much do you smoke?
About a half a pack a day.
Okay. What about alcohol?
I don't drink.
Okay. Also, are you married?
Yeah, I'm married.
Okay. And children?
No.
Okay. And just some additional questions is looking at your kind of GYN history. Are you last menstrual period?
Oh, I'm in menopause.
Okay. So going back into the history again, have you? You said your mom had migraines. earlier on. Have you been around and you haven't been nauseous, or have you been? any
Yeah,
other sickness?
I've been nauseous.
Okay.
In fact, I threw up twice early on.
Okay.
Because when I move, it makes me nauseous.
Okay.
Yeah.
Nothing out of the ordinary over the past couple weeks. Have you been on any trips or anything? Or
Actually, a week
Seen it-
ago, I was in North Carolina for a family reunion.
Okay.
And there was a 4-year-old who was sick there. I don't know what they had, but
Okay.
I guess they ended up taking him into emergency.
All right. So let me just summarize to make sure I've got everything straight so far. Is you started having an onset of a severe headache about 3 days ago. It's worse with movement. Light really makes it hurt bad. It's a 10 out of 10 pain, and you're also complaining of a stiff neck with that.
Yes.
It came on gradually, and it's been constant pain in the frontal area. Medical history, you have high blood pressure, but that's controlled with diet. No surgical history, no really hospitalizations. The pain, though, isn't really impacting your day-to-day living and daily life. You tried Tylenol, Motrin, it didn't help. Otherwise, no medications. You've got the family history of your mom with migraines. Otherwise, your family is healthy.
Yeah.
You smoke about a half a pack a day. You don't drink. And then you said you took a trip about a week ago or 2 weeks ago?
Yeah.
Okay.
It was a
And you might
family
have been contact with
reunion a
somebody
week
who's sick?
ago.
Okay.
Yeah, I don't know. It was in North Carolina.
All right. Yeah, I can understand your concern about your friend. You said that he was having seizures.
I've just never had this kind of pain before.
Yeah, and I can understand that. And, so what I would like to do is, we've pretty much gone over the history. What I'd like to do is complete a physical exam.
Okay.
Do some testing.
All right.
And I want to ask too if there's any other concerns I need to address before we get to that final exam.
Okay. That sounds good.
Okay, sounds great.
Okay. All right. Hi, I'm Deb.
Yes, oh, hi.
I'm your
Brief.
standardized patient.
Right.
Nice job. I'm going to give you some feedback on your communication skills
right.
in this encounter. But before I do, how did you feel it went?
I think pretty good. I was nervous at first, I think, and just trying to make sure that I was getting all your patient information so we could, make sure we got the correct tests and
Yeah.
Yeah.
How did you feel when you walked in? You feel pretty comfortable?
I think I got more comfortable as we sat down and got to talking.
I could see that. Yeah, good. Okay. Well, I thought you did a nice job. You had an appropriate introduction, introduced yourself, first and last name, shook hands. I think you have a very warm demeanor and you're comfortable, which makes me as a patient comfortable. You did elicit my chief complaint and asked about any other concerns, and that's when I told you I was also concerned about my insurance, so that was another thing on the agenda. So you did set a mutual agenda, asked me if I agreed, and so we had a clear roadmap going forward, so you did, you hit all those real well. Your first question, tell me about this pain, or that was a nice open-ended question, so it allowed me to then tell my story. Followed up with some more pointed questions just for clarification on, and you're an active listener, had eye contact, and could do a little bit more reflective listening, just little points where you could verify, check for accuracy, maybe paraphrase as I'm going through. You did a nice summary in the middle, that's good, but just a little bit more reflection on that to let me know as a patient that you're hearing me. You asked my perspective of what I thought was going on, and then you got the story of my fear that maybe I've got a brain tumor. Oh no. Yeah. So I thought you had nice flow, logical sequence of questioning. little bit of signposting. We just covered this, and now we're going to do that. I heard that once. And as these interviews get longer, you're going to want to signpost between each section. I've taken your history. Now I'd like to go into did a nice summary in the middle. You moved through quickly, so you attended to the timeline. You did ask permission to ask some social questions. Maybe you want to mention social questions may not be a flag for me that this could be personal or uncomfortable. Maybe I'm going to ask a little more some personal questions here. Is that all right with you? Just so social question sounds fine to me until you start asking something that might sound personal. So you might use the word some more personal.
Perfect.
Questions here. Non-judgmental. Didn't bat an eye when I said I smoke half a pack. You have nice vocal range, eye contact, comfortable demeanor, so that felt real good. And then you did a summary at the end and asked, did you ask do anything else? Okay, so anything else before we do a physical exam? So it was very nice encounter.
Well, thank you so much. Nice meeting you.
You too.
So this video pretty well sums up the entire class. So all the 7 steps of Kalamazoo's communication skills and how we have to, how we can analyze or have a reflection of what went wrong and what went right and all. So I'll be giving you the link of what are the checklists. So have a look at this. One is this Kalamazoo Essential Elements Communication Checklist. Can you see this? So after you do a doctor-patient encounter, like you'll be seeing like what are the various things, checklist, whether the doctor has done well, like in building a relationship, whether, for example, whether the doctor has greeted or has shown interest in patient as a person. So you can check whether the doctor has done well, whether he needs approval, whether it is not done and all. So by knowing this checklist, like you can try to improve. You can know where you have gone wrong also. So this is one checklist. The other being Brown interview checklist is also available. So here also, it's a little different, but everything's the same. Okay. Opening, like whether you have greeted, whether you have introduced, then whether the various checklists, like you can go through it. So I think that brings us to the end. So Harish is there. Harish, Gayatri. Gayatri. Gayatri is there. Amritam. So there seems to be a communication gap over here also. I'm not very comfortable doing this Zoom, but still this is the only way that we can do it now. Because so many, like already you have 175 people. So it is very difficult to teach it, to show all this to 175 all at a time.
Madam, Dr. Renju is here. I'm very much here.
Renju sir. Sir, initially, I chose Renju sir.
Madam, problem was actually I was caught up in a meeting with the principal. Okay. And by the time the meeting was over, it was somewhere around 5 o'clock. So then I had to suddenly dash home, and now actually I'm traveling back home, So I had a problem with the connection also. So I was able to hear, but towards the last, something happened to the audio system in this, and Can you hear me? Am I
very
audible?
clear. Now it's very audible. Very much. Very much.
You can hear me, but the problem is I can hear you only very faintly. But okay, madam, let me give my sort of recap on this class.
Okay.
I think all the students would have been really benefited by this class because I think the whole aspect of the whole domain of communication has been wonderfully taken by you with ample examples in the form of short videos. And I also think that the students will also be ready, for the next coming sessions that madam has already told that we'll soon be designing this role plays where you will be given clinical scenarios. And I think there's certainly going to be a lot of enthusiasm in this batch because some of the people who are really interested and who are very much into acting can certainly take up these roles. And also I want to make a point is that some of the situations may, though may be a little difficult, but actually you can do it according to what you perceive or according to your basic understanding, because there is no, actually in these situations there can be a little difference of opinion. Sometimes what we perceive and what we have in mind will be little different from what you people will be showing. So never mind about that. And also you have your mentors, because madam will be distributing you the students among different mentors. So they will also be guiding you all through this way. So madam, once again, I thank you wholeheartedly for this wonderful session. And shall I sign off?
Okay, thank you very much for your
okay, madam, you
encouraging
can
words.
give your final comments on this. You can give your final comments on this.
The only
Thank
thing
you,
is
and
two-way talking is different. I was doing all the talking, so I was thinking like I'm teaching about communication, but I'm not able to hear from the other side. The problem is like when I stop this, something happens to the system, and then I have to restart the whole thing. So that is why I was trying to avoid this conversation in between. Otherwise, I think if we had this conversation in between, it would have been more engaging also. The problem was with the systems and all. No? Like the moment I try to open the chat, the video stops or something happens to the audio and all. Okay, Srilata madam has joined. I don't know.
Srilata madam, we want your comments, and we all, as the students, also want to listen to you.
Madam,
we can also have some of the views from the students as well.
Yeah,
if they have
students
queries,
also,
or if they want to make their own observations on this, I think the floor is open for discussion also, madam. Some of the students can address this.
The main thing is about communication. So we need to learn from your side also. Anybody can give a comment.
Yes, madam. They are all very fresh from their go-on trips also. So they will have a lot of ideas about communication also. They can also volunteer.
Sneha is there? Sneha from physiology.
Yeah, absolutely, ma'am.
Sneha പറഞ്ഞോളൂ.
മാഡം ഞാൻ കുറച്ച് ലേറ്റായിട്ടാ ജോയിൻ ചെയ്ത്. ഞാൻ എത്താൻ താമസിച്ചു പോയി. അപ്പൊ എനിക്ക് മാഡത്തിന്റെ ആദ്യ ഭാഗം ഒന്നും കേൾക്കാൻ പറ്റിയിട്ടുണ്ടായില്ല. So like towards the end I have seen, but but I can't ആദ്യം മുതൽ കാണാത്തതുകൊണ്ട് എനിക്ക് ആ ഒരു
അല്ല ലാസ്റ്റ് വീഡിയോയിൽ എല്ലാം ഉണ്ട്, ഈ പറഞ്ഞതെല്ലാം ഉണ്ട്. നമ്മളിപ്പോ ഇത് എന്താ പറയുന്ന ഈ റെസിപ്പി പറയുമ്പോ ഓരോന്ന് സ്റ്റെപ്പായിട്ട് പറയായിരുന്നത് ലാസ്റ്റിലെല്ലാം ചേർത്തിട്ട് ആ വീഡിയോയിലെല്ലാം ഉണ്ട്. ഒരു സ്റ്റാൻഡർഡൈസ് പേഷ്യന്റ് പറയുന്നില്ലേ, ഒരു ഡോക്ടർ തന്നെ ലൈക്ക് ഷീ acts as a patient and she gives a feedback. അതിൽ തന്നെ എല്ലാം ഉണ്ട്. ലൈക്ക് how to greet a patient, അല്ലെ, greeting എങ്ങനെയുണ്ട്, opening the conversation, gathering the information, understanding the patient's perspective, then making conclusion, making plans, closure, everything. അതിലെല്ലാം അവർ തന്നെ എല്ലാം ഡൈസെക്ട് ചെയ്തിട്ട് എല്ലാം പറയുന്നുണ്ട്. അത് തന്നെയാണ് like we are expecting from other people.
And I personally feel that communication is the most important thing. I mean, knowledge is very, very important, but equally important with knowledge is actually the communication part. If you have sufficient knowledge, but if you are not able to communicate things properly, then knowledge won't be of any use at all.
Nowadays, especially like we hear so many violence against doctors and all. I think main problem is this communication problem.
Communication gap. So I think the communication skill is one of the essential skill that you should be, you should be having when you are planning to practice. That's the most essential skill that you should be possessing. Even if you have some mistakes that ipo namakku valare priyappetta doctorinte bhagathunnu oru tettu pattiyalum I have read cases like that legal ആയിട്ട് അതിന്റെ ഇഷ്യൂസ് വരുമ്പോഴത്തേക്കും ആ ബൈസ്റ്റാൻഡേഴ്സ് അല്ലെങ്കിൽ പേഷ്യൻസ് തന്നെ അത് ചിലപ്പം അവരുടെ ഭാഗത്തുനിന്ന് അവരൊരു വിട്ടുവീഴ്ചയ്ക്ക് തയ്യാറാവും. കാരണം അവർക്ക് അവരുടെ ഡോക്ടർ എത്രത്തോളം നല്ലതാണ് എന്നുള്ള ഒരു കമ്മ്യൂണിക്കേഷൻ റാപ്പും ഒക്കെ ഉള്ള സമയത്ത് ഉണ്ടെങ്കിൽ അവർ പല കാര്യങ്ങളും ഒഴിവാക്കാൻ പറ്റുന്ന സാഹചര്യങ്ങൾ ഉണ്ടായിട്ടുണ്ട്.
One incident like in which is narrated by my HOD ENT in while I was DNB student at Calicut Medical College. Sir പറഞ്ഞു ഇപ്പൊ ഒരു ട്രിവാൻഡ്രം മെഡിക്കൽ കോളേജിൽ എങ്ങാണ്ട് ഒരു സാർ ഒരു കമലിയൻ പേഷ്യന്റ് ആയിരുന്നു. നമ്മൾ മാസ്റ്റോയിഡ് സർജറി ചെയ്തു. അപ്പൊ സർജറി ചെയ്യുമ്പോൾ കൺസെന്റ് ഒക്കെ എടുക്കല്ലോ. അപ്പൊ ഫേഷ്യൽ പാൽസിക്കൊക്കെ നമ്മൾ ഫേഷ്യൽ നെർവ് പാസസ് ത്രൂ ദ മിഡിൽ ഇയർ. ഫേഷ്യൽ നെർവ് പാൽസിയുടെ എല്ലാം കൺസെന്റ് ഒക്കെ എടുത്തു ആ പേഷ്യന്റിനോട്. And unfortunately the patient developed facial nerve palsy. അപ്പൊ പേഷ്യന്റ് എന്താന്നറിയോ പറഞ്ഞത്? ഈ ഡോക്ടർ എന്ത് നല്ല ഡോക്ടറാണ്, ഡോക്ടർ പറഞ്ഞു ഓപ്പറേഷന് മുമ്പ് തന്നെ മുഖം ഓടിപ്പോവും. അതേപോലെ തന്നെ സംഭവിച്ചു. കണ്ടോ ഡോക്ടർ എത്ര അറിവുള്ള ഒരാളാണെന്ന്. ലൈക് ഡോക്ടർ വാസ് ഫ്രൈറ്റൻഡ് ലൈക് അതാണ് ആ കമ്മ്യൂണിക്കേഷന്റെ ഇമ്പോർട്ടൻസ്.
അതെ, അവിടെ വേറൊരു കാര്യം കൂടി ഉണ്ട് മാഡം. ഇപ്പൊ നമ്മുടെ പേഷ്യൻസ് എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ അവര് ഗൂഗിൾ സെർച്ച് നടത്തി ഇവർക്ക് വരുന്ന എല്ലാ ഡിഫറൻഷ്യൽ ഡയഗ്നോസിസ് അടക്കം എല്ലാ കാര്യത്തിനെ പറ്റി വളരെ വ്യക്തമായിട്ടുള്ള ഒരു ധാരണയോട് കൂടിയാണ് വരുന്നത്. അപ്പൊ നമുക്കത് ഇഫക്റ്റീവ്ലി പേഷ്യന്റ് അടുത്ത് കമ്മ്യൂണിക്കേറ്റ്, പണ്ടുള്ള പേഷ്യൻസിനെ പോലെ അല്ല ഇപ്പോഴത്തെ ആൾക്കാർ. അപ്പൊ സോ വി ഹാവ് ടു ബി വെരി കെയർഫുൾ വിത്ത് ദ സ്കിൽസ് ദാറ്റ് വി ഹാവ്, ലൈക് ദ കമ്മ്യൂണിക്കേഷൻ സ്കിൽസ്. അത് വേണ്ട രീതിയിൽ കൃത്യമായിട്ട് ഉപയോഗിച്ചിട്ടില്ലെങ്കിൽ അത് ചിലപ്പോൾ നമ്മളെ ബൂമറാങ് പോലെ വന്ന് തിരിച്ചടിക്കാനും സാധ്യതയുണ്ട്.
പിന്നെ സ്റ്റുഡൻസ് ആയിട്ട് നിങ്ങൾ വരുമ്പോഴും തന്നെ ഇപ്പൊ മൊബൈൽ ഫോൺസ് ഒക്കെ അല്ലേ, ലൈക്ക് മൊബൈലിൽ ഇങ്ങനെ നമ്മള് പേഷ്യന്റ് വന്ന് ഇരിക്കുന്ന സമയത്ത് മൊബൈലിൽ ഇങ്ങനെ ചാറ്റ് ചെയ്തുകൊണ്ടിരിക്കുക, അവരെ കാര്യങ്ങൾ ശ്രദ്ധിക്കുന്നില്ല. അവിടെ മരിച്ചു കിടക്കുന്ന പേഷ്യന്റ് സമയത്തുണ്ടാകുമ്പോൾ നിങ്ങൾ ഉറക്കെ വീഡിയോസ് എടുത്ത് കാണുക. അതൊക്കെ all those should be avoided.
And apart from the verbal communication, the non-verbal communication, especially the eye contact and your facial gestures, how you actively listen to the subject, all those things are extremely important. That communication doesn't end with your verbal communication. It also includes your non-verbal clues or non-verbal cues or non-verbal communication, how you interact with your expressions, and all those things matter a lot.
The tone of telling everything also. Tone everything all. Okay, students എന്തെങ്കിലും പറയാനുണ്ടോ?
അവർക്ക് വേണമെങ്കിൽ ഇതുവരെയുള്ള ഇവരുടെ ക്ലിനിക്കൽ സൈഡിൽ നിന്നുള്ള എക്സ്പീരിയൻസസ് വെച്ചിട്ട് they can tell അല്ലേ what is the importance of communication in patient care.
അതെ റൈറ്റ് മാഡം.
അവർ ഒരുപാട് കാര്യങ്ങൾ ഇപ്പൊ കണ്ടു കഴിഞ്ഞല്ലോ. അപ്പൊ അവർക്ക് തന്നെ മനസ്സിൽ പലപ്പോഴും നമുക്ക് തോന്നിയിട്ടുണ്ടാവും നമ്മളിങ്ങനെ ആവണം അല്ലെങ്കിൽ നമ്മളിങ്ങനെ ആവരുതെന്ന്. അപ്പൊ പേരൊന്നും പറയണ്ട, പേര് പറയാതെ തന്നെ യു ക്യാൻ ഷെയർ യുവർ എക്സ്പീരിയൻസസ്.
പിന്നെ അതല്ല, നിങ്ങൾ ഇതിന്റെ ഒരു റിഫ്ലക്ഷൻ എഴുതുക. നിങ്ങൾക്ക് ലൈക്ക് വാട്ട് യു ഫീൽ, വാട്ട് യു ഹാവ് ലേൺ ഫ്രം ദിസ്, വാട്ട് യു ഗോയിങ് ടു ഡു എന്നൊക്കെ യു ക്യാൻ റൈറ്റ്. ഇത് നിങ്ങൾ CBME ഒരു പാട്ടല്ലേ, അപ്പൊ ഇത് ഈ ക്ലാസിന്റെ റിഫ്ലക്ഷൻ ഒക്കെ എഴുതണ്ടേ? അപ്പൊ അത് എഴുതണം. അറ്റൻഡൻസ് ഒന്ന് തരണേ. ആരാണ്? അമൃത അല്ലേ? അറ്റൻഡൻസ് ഒന്ന് തരണം. ഇതിന്റെ പറ്റിയിട്ട് റിഫ്ലക്ഷൻ എഴുതണം. പിന്നെ നെക്സ്റ്റ് ക്ലാസ്സിൻ്റെത് ഒന്ന് അറിയിക്കണം കേട്ടോ. ഇതിന്റെ ഞാൻ ചെക്ക് ലിസ്റ്റും ഞാൻ അയക്കാം, ഈ വീഡിയോസും ഞാൻ അയക്കാം കേട്ടോ. ഞാൻ ഗൂഗിൾ ഫോം ചോദിച്ചിട്ട് ഇപ്പൊ എത്ര 150 പേരെങ്ങാണ്ടേ ഉള്ളൂ. അത് എനിക്ക് ആദ്യം ചോദിച്ചപ്പോഴൊന്നും കിട്ടിയില്ല. നേരത്തെ കിട്ടിയിട്ടുണ്ടെങ്കിൽ എനിക്ക് സമയം കിട്ടിയില്ല ഞാൻ അത് അയക്കാനൊന്നും. അല്ലെങ്കിൽ ഈ മെറ്റീരിയൽ ഒക്കെ നേരത്തെ അയക്കായിരുന്നു. ചെക്ക് ലിസ്റ്റിന്റെ കൂടി ഞാൻ അയക്കാം. ഐ തിങ്ക് ഞാൻ മറ്റേ എയ്റ്റ്കോമിന്റെ ഗ്രൂപ്പിൽ ഇട്ടിട്ടുണ്ട് ഈ ചെക്ക് ലിസ്റ്റ് ഒക്കെ. സോ നെക്സ്റ്റ് ടൈം when they come, like we can see, like. So anything else? Otherwise, I think we can sign off. മഴ ഇടി മിന്നലൊക്കെ വരുന്നുണ്ട്.
We didn't have any views from the students yet. We didn't have any views. Their opinions,
Students
remarks,
communication
feedback.
എളുപ്പം പറഞ്ഞോളൂ. ആരെങ്കിലും ഞാനെങ്കിൽ പേര് വിളിക്കണോ ആരെങ്കിലൊക്കെ?
Anyway, nobody is going to see you.
Yeah, and also this is the stage where you can develop your communication skill, how effectively you can interact with your seniors, or those kind of skills you can develop. Or with your peers, how you have your views. In that way you can develop your communication skills.
Let me tell you, like I was very introvert. Like I wouldn't speak to anybody. If I were not a doctor, I think I would not have become like this. Like because I became a doctor, I learned this how to speak and all.
Yeah.
Right.
അപ്പൊ ആരാ പറയണേ? ആരുടെങ്കിലും ചോദിക്കാൻ വേണം, നമുക്ക് പേര് വിളിക്കാം.
അമൃതയുണ്ട്, ക്ലാസ് റെപ്പ്. എന്തെങ്കിലും പറഞ്ഞോളൂ.
അമൃത നല്ല കമ്മ്യൂണിക്കേഷൻ സ്കിൽ ഉള്ള കുട്ടിയാണ്. അതുകൊണ്ട് എനിക്ക്
അല്ല, ഇപ്പൊ യൂട്യൂബേഴ്സ് അല്ലേ എല്ലാ കുട്ടികളെല്ലാം ഇൻസ്റ്റാഗ്രാമിലും യൂട്യൂബിലും അല്ല. ഞങ്ങളെ കാലം പോലെ അല്ല. പിന്നെ ഞങ്ങളെ കാലഘട്ടത്തിലൊക്കെ എന്താ പറഞ്ഞാ മിണ്ടാതിരിക്കണം അല്ലെ, അനുസരണ ഉള്ളവരാണ്, മിണ്ടരുത് എന്നൊക്കെയാ പറയുന്നത്. ഇപ്പോഴത്തെ കാലത്ത് അങ്ങനെയല്ല.
അതെ, ഇൻഡിവിജ്വലിസം ആണ് കൂടുതലായിട്ടും. അടിച്ചമർത്തപ്പെടലുകളൊക്കെ ഇങ്ങനെ മാറിക്കഴിഞ്ഞു. കൂടുതൽ ഇൻഡിവിജ്വലിസത്തിനാണ് ഇപ്പൊ കൂടുതൽ പ്രാമുഖ്യം കൊടുത്തോണ്ടിരിക്കുന്നത്. അപ്പൊ അമൃതയ്ക്ക് നല്ല കമ്മ്യൂണിക്കേഷൻ സ്കിൽ ഉണ്ടെന്ന് എനിക്കറിയാം. അമൃത പറഞ്ഞോളൂ, എന്താ അമൃതയുടെ ഒപ്പീനിയൻ?
മാം, ക്ലാസ് ഭയങ്കര നല്ലായിരുന്നു. ഇറ്റ് വാസ് ഓൾ എൻഗേജിങ് ത്രൂ ഔട്ട്. വീഡിയോസും ചെറിയ എലിമെന്റ്സ് കെപ്റ്റ് ത്രൂ ഔട്ട് ദി സെഷൻ. ആൻഡ് ടു ബി ഓണസ്റ്റ്, ഇപ്പൊ കുറച്ച് നാളായിട്ട് കാണാത്തതിന് കൂടുതലും സ്ട്രെങ്ത് നമ്മുടെ ഈ പ്രാവശ്യം ഈ മീറ്റിൽ കണ്ടിട്ടുണ്ട്. ഇൻഫാക്ട് യൂട്യൂബ് ഒക്കെ നമുക്ക് സ്വിച്ച് ഓൺ ചെയ്യുന്ന ആവശ്യമൊന്നും സ്ട്രെങ്ത് കൂടിയുണ്ട്. പിന്നെ ഓൾ ടുഗദർ വി അണ്ടർസ്റ്റാൻഡ് നൗ. ഇപ്പം നമ്മൾ ക്ലിനിക്സിൽ this is the first time we are actually entering into the clinic, so we understand how important actually communication is. It looks like it's ellarku ulla path aanu, but when we do it in practice, we understand how important each gesture, it's not just verbal communication, even non-verbal things implements and takes our conversation to the patient in a long way. So your session was definitely very useful to us, and we're looking forward to the next session, which is coming, I believe, next week. And I'm happy, like almost the majority has attended it, and we had good people to educate about it.
In fact, how was your experience during your clinics? അതും കൂടെ പറയണം. നിങ്ങൾ ഇപ്പൊ 3 മാസമായോ ക്ലിനിക്സ് തുടങ്ങിയിട്ട്?
Yes ma'am, almost.
കേസസ് ഒക്കെ എടുക്കാൻ തുടങ്ങിയോ?
ഉണ്ട്, നമ്മൾ ഹിസ്റ്ററി ഒക്കെ എടുക്കുന്നുണ്ട്. കമ്മ്യൂണിക്കേഷനകത്ത് ഐ എം ആക്ച്വലി ഞാനൊരു നോൺ മലയാളി ആയിട്ട് കിട്ടാണ്ട് എനിക്ക് കുറച്ചും കൂടി അറിയാം എങ്ങനെയാണ് കമ്മ്യൂണിക്കേഷൻ ഒരു ബാരിയർ ആയിട്ട് എനിക്ക് ഫസ്റ്റ് ഇയർ തൊട്ട് ഉള്ളത്. സോ ഐ ഹാവ് ഇവോൾവ്ഡ് മൈ കമ്മ്യൂണിക്കേഷൻ ഇൻ ദ ലാസ്റ്റ് 1 or 1.5 year. സോ ഡെഫിനറ്റ്ലി ഇത് ഹോസ്പിറ്റലിൽ പോകുമ്പോൾ മെയിൻലി ഒരു ബർഡൻ അല്ലെങ്കിൽ ഒരു ബാരിയർ ആയിട്ട് വരുന്നത് ലൈക്ക് ദി ലോക്കൽ ലാംഗ്വേജ് അല്ലെങ്കിൽ സ്ലാങ്. നമ്മൾ സാധാരണ 1-to-1 കമ്മ്യൂണിക്കേഷനായിട്ടും വി നീഡ് ടു നോ സം അങ്ങനെ ലോക്കലി യൂസ് ചെയ്യുന്ന ടേംസും ഷുഡ് നോ ഹൗ ടു കംഫർട്ട് ദ പേഷ്യന്റ് ഫസ്റ്റ് ടു ഹാവ് ദ റാപ്പോ സോ ദാറ്റ് ദേ ടെൽ അബൌട്ട് ദെയർ പ്രോബ്ലംസ് ആൻഡ് തിങ്സ്. സോ ഡെഫിനറ്റ്ലി ഇപ്പൊ ക്ലിനിക്കൽ എക്സ്പോഷർ വെച്ചിട്ടാണ് ലൈക്ക് ഫസ്റ്റ് ഇയർക്ക് നമ്മൾക്ക് ഇങ്ങനെ കമ്മ്യൂണിക്കേഷൻ അങ്ങനത്തെ കാര്യങ്ങളിലൊക്കെ ക്ലാസ് ഉണ്ടായിരുന്നു. ബട്ട് ദെൻ സ്റ്റിൽ നൗ വെൻ വി ആർ ആക്ച്വലി ഡൂയിങ് ഇറ്റ് ഇൻ പ്രാക്ടീസ് വി അണ്ടർസ്റ്റാൻഡ് ദി ആക്ച്വൽ ഇമ്പോർട്ടൻസ് ഓഫ് ഇറ്റ്. So it's been very enlightening, and we actually understand it like thoroughly. Endana cheyendenne, enganana cheyende, and how each thing is actually important, specifically in a profession like ours. So clinics has actually it's been helpful. Yeah.
For doctors, this is very important when compared to other professions, no?
Yes, definitely. Yes, ma'am. That's
Okay.
it. Thank you for the session.
Okay, thank you. ഇനി വേറെ ആർക്കെങ്കിലും എന്തെങ്കിലും ആഡ് ചെയ്യാനുണ്ടോ? എന്തെങ്കിലും ആഡ് ചെയ്യാനുണ്ടെങ്കിൽ പറഞ്ഞോളൂ. Otherwise we'll sign off. ആരൊക്കെ ഉള്ളതെന്ന് എനിക്കറിയില്ല. നമ്മള് സ്നേഹ വേറെ ആരൊക്കെ ജോയിൻ ചെയ്തിട്ടുള്ള? ഗായത്രി ഉണ്ട്.
ഒരു പോയിന്റ് കൂടെ I want to make one more point. അതായത് it is said that breakdown in communication is supposed to be one of the greatest factors that lead to violence against doctors, that lead to allegations of negligence against doctors. So it is said that at the communication level, if you are able to sort out things, in the long run, you're actually, you won't face any hostile or any type of untoward events like this. So that is one of the foundations of communication, is that it goes a long way in self protection of the doctor community also. So that is also it is actually a view that has been studied through research actually. So that is also one thing that I want to point out. Yes, madam.
I fully agree with you, sir. Harish undo. Harish. ഹരീഷ്
മാഡം ഞാൻ ഗായത്രിയാണ്.
ഗായത്രി.
മാഡം സെക്ഷൻ ഭയങ്കര നല്ലതായിരുന്നു മാഡം. ഞാൻ തുടക്കം മുതൽ കേട്ടായിരുന്നു. ഞാനിപ്പോ ആക്ച്വലി ട്രാവലിംഗ് ആയതുകൊണ്ട് ഇച്ചിരി ഇൻട്രസ്റ്റഡ് ആയിപ്പോയി. അതർവൈസ് ഐ ഹേർഡ് ദി ഹോൾ സെഷൻ. ഇറ്റ് വാസ് വെരി ഇൻട്രസ്റ്റിംഗ് വിത്ത് വീഡിയോസ്. ശരിക്കും നല്ല ക്ലാരിറ്റി ഉണ്ടായിരുന്നു ഫുൾ സെഷൻ. നല്ല ഇന്ററാക്റ്റീവ് സെഷൻ ആയിരുന്നു. ഇതിന് ഒരു കാര്യം എനിക്ക് പറയാനുള്ളത്, ഇപ്പൊ നമ്മളുടെ കമ്മ്യൂണിക്കേഷൻ സ്കിൽസിൽ ഒരു ഭയങ്കര ഇപ്പം മൊത്തത്തിൽ ഒരു ആക്ച്വലി ഒരു റെവല്യൂഷൻ, സ്പിരിച്വൽ റെവല്യൂഷൻ ടേക്കിംഗ് പ്ലേസ്. സോ ലൈക്ക് ഹൗ മച്ച് ഓഫ് എംപതി യു ക്യാൻ ഷോ ടു യുവർ പേഷ്യൻസ്, ദാറ്റ് പ്ലേസ് എ വെരി ഇമ്പോർട്ടന്റ് റോൾ. ഈ പണ്ടത്തെ പോലെ ഇപ്പൊ നമ്മൾ പേഷ്യൻസിന്റെ ഒരു സിറ്റുവേഷൻ വെച്ചിട്ട് നമ്മൾ അവരുടെ കണ്ടീഷൻസ് ആയിട്ട് സിമ്പതൈസ് ചെയ്യാതെ ഹൗ യു ക്യാൻ എംപതൈസ്.
Shibu sir is also there. I think.
Communication. When we are engaging in communication with the patient, we should also think in that aspect. How we can empathize, what you can do, whether there is any scope for alleviating the suffering of the patient. ആ രീതിയിലുള്ള ചിന്തിക്കേണ്ട ഒരു ഇതാണ്. എംപതി ആക്ച്വലി അതൊരു റെയർ സ്കില്ലായി മാറിക്കൊണ്ടിരിക്കുന്ന ഒരു സമയമാണ്. Otherwise, all areas we have touched, so that നമ്മുടെ ഈ role plays, I think the students will have a very good idea of how to carry out their role plays. So ഇത് കഴിഞ്ഞിട്ട് നമുക്ക് കേസിനെ ഡിസ്കസ് ചെയ്തിട്ട് we can plan the next.
അതെ, ആ ലാസ്റ്റ് വീഡിയോ പോലെ എനിക്ക് തോന്നുന്നു ഇവര് എനാക്ട് ചെയ്താൽ മതി. ലാസ്റ്റ് വീഡിയോ പോലെ ഓരോ കേസ് സിനാരിയോ പോലെ ഒരാള് പേഷ്യന്റ് ആയിട്ടും ഒരാള് ഡോക്ടറായിട്ടും അങ്ങനെ എനാക്ട് ചെയ്തിട്ട് ചെയ്യാം. Like we can decide like what are the various steps, like whether if all the steps went on well, like how we can improve it. Okay, Harish, I think is in YouTube ഉള്ളവർക്ക് ഇതിൽ കയറി സംസാരിക്കാൻ പറ്റുമോ? എനിക്കറിയില്ല.
ഇല്ലാന്ന് തോന്നുന്നു മാഡം. ഇല്ല, അവിടെ മെസ്സേജ് ടൈപ്പ് ചെയ്യാനേ പറ്റുള്ളൂ, കമന്റ്സ് ഇടാനേ.
Okay, അപ്പോൾ I think we'll sign off then. If there is anything, like I think you can WhatsApp lo endengilokku in message ayikam. Okay, I think we can sign off. Gayatri, Ranjan sir, Sneha.
Thank you, ma'am.
Yes, madam. Actually in forensic medicine they have separate WhatsApp sites. A number of students have been assigned to a particular teacher for which they have a WhatsApp site. They can also give their comments on that. And if you want any feedback also, they can post it on that. You're free to do that. Because I think there shouldn't be a sort of any type of formality in this. This is a very flexible and dynamic forum where we are actually trying to nurture the skills in you so that you become good clinicians. അതാണ് എനിക്ക് പറയാനുള്ളത്.
I think Ranjan sir class എടുത്താൽ മതിയായിരുന്നു തോന്നുന്നു. So I think
absolutely not. I am not a clinician, by the way. I am not a clinician, and I think you are the epitome of communication skills in the college. Thank you, madam. Thank you wholeheartedly.
സാറേ ക്ലിനിഷ്യൻ ആവണമെന്നില്ല. അപ്പൊ വ്യാജ ഡോക്ടർമാർ എങ്ങനെയാണ് അവര് ഇതാകുന്നത്? അവരെ കമ്മ്യൂണിക്കേഷൻ സ്കില്ല് കൊണ്ടല്ലേ അവര് നമ്മളെ ഡോക്ടർ.
അല്ല, അത് madam, even the actors in the films, for movie stars, film stars, artists. They are the best communicators. In fact, ipo oru movie la punch dialogue will be remembered from generation to generation.
And I feel the new generation students, ഇപ്പോഴുള്ള കുട്ടികളാണെന്ന് തോന്നുന്നു, they have got a better communication skill എന്നാണ് എനിക്ക് personally തോന്നിയിട്ടുള്ളത്.
Very much so. Very much so.
They don't have that kind of നമ്മുടെ പോലത്തെ ഒരു ഇൻഹിബിഷൻസ് വേറെ ഒന്നും ഇല്ല. അവർക്ക് ആ കാര്യങ്ങൾ കൃത്യമായിട്ട് പറയാനും അവര് തന്നെ അവരെ സെൽഫ് റെസ്പെക്ട് നമ്മളെക്കാട്ടിലും കുറച്ചുകൂടി കൂടുതലുണ്ട്. സോ ഐ തിങ്ക് ദേ ഹാവ് എ വെരി ഗുഡ് കമ്മ്യൂണിക്കേഷൻ സ്കിൽ.
My generation, we never had land phone also. When I was born, we never had land phone also. Like we were feeling so frightened to speak to a stranger. ലാൻഡ് ഫോണിലുള്ള അപ്പുറത്ത് എൻഡില് വേറെ ആരെങ്കിലും ഒരു സൗണ്ട് കേട്ടാ പേടിച്ചു പോവായിരുന്നു. ഇപ്പൊ ജനിച്ച കുട്ടികൾക്ക് എല്ലാം അറിയാം. വാട്സാപ്പും മറ്റേ ഇൻസ്റ്റാഗ്രാമിലും യൂട്യൂബിലും എല്ലാം എന്താ ഹലോ ഗൈസ് എന്ന് പറഞ്ഞിട്ടല്ലേ എല്ലാരും നന്നായിട്ട് സംസാരിക്കുന്നത്.
നമ്മുടെ സ്കിൽ എക്സാമിന് പോലും മാഡം ഈ ഓസ്പി സ്റ്റേഷൻസിൽ കുറച്ച് മാർക്ക് അവരുടെ കമ്മ്യൂണിക്കേഷൻ സ്കില്ലിന് വേണ്ടിയിട്ടാണ് കൊടുക്കുന്നത്. അപ്പൊ ഈ എക്സാമിനേഷൻ ചെയ്യാൻ അറിയാത്ത കുട്ടികൾ പോലും എല്ലാവർക്കും കമ്മ്യൂണിക്കേഷൻ സ്കില്ലിന് മാർക്കുണ്ട്. കാരണം അവർ വന്നിട്ട് ഇൻട്രൊഡ്യൂസ് ദംസെൽസ് ടു ദ സബ്ജക്ട്, എന്നിട്ട് ഇങ്ങനെയാണ് ചേട്ടാ, എന്റെ പേര് ഇങ്ങനെയാണ്, ചേട്ടന്റെ പേര് എന്താണ്, ഇതെല്ലാം ചോദിക്കാൻ ഒരാൾ പോലും അത് ആ ഒരു ഭാഗം തെറ്റായിട്ട് ചെയ്തിട്ടില്ല. all of them did well. അപ്പൊ ഞാൻ അവരോട് പറയുകയും ചെയ്തു, നിങ്ങൾക്ക് കുറച്ചും കൂടെ ആക്ടിങ്ങിനകത്തും നല്ല ഭാവിയുണ്ട്, കാരണം വളരെ കൃത്യമായി ചെയ്യുന്നുണ്ട്.
Okay, then I think we can make a no.
Okay, madam. Good night to all. Good night to all students. Good night to all of faculty.
Thank you very much for patience.
Bye.
Bye, everybody.
Bye.
Thank you, ma'am.
Thank you, ma'am.